Hello and welcome back to Wally's nursing videos. I'm Wally, and today we're diving into a fascinating journey through the intricate world of the endocrine system and its profound impact on healthcare and nursing. Whether you're a seasoned nursing professional or an aspiring student, understanding the endocrine system is not just a critical part of your profession, it's a passion that drives the heart of patient care. In this educational series, we'll explore the anatomy, functions, feedback mechanisms, and clinical relevance of the endocrine system. It's not just about the glands and hormones, it's about the lives you'll touch, the difference you'll make, and the moments of care that define your journey as a nurse. So, whether you're preparing for exams, looking to expand your knowledge, or simply curious about the world beneath the white coat, you're in the right place. Grab your notes, your favorite drink, and let's embark on this educational adventure together. Get ready for an in-depth exploration of the endocrine system and its clinical relevance in nursing right here on Wally's Nursing Videos. Let's dive in! We start with anatomy of the endocrine system. Components. Pituitary gland, a small pea-sized gland located at the base of the brain, often referred to as the master gland due to its control over other endocrine organs. Thyroid, a butterfly-shaped gland located in the neck responsible for producing thyroid hormones T3 and T4. Parathyroid, 4 small glands on the back of the thyroid that regulate calcium and phosphorus balance. Pineal glands, a tiny gland in the brain that secretes melatonin, influencing sleep-wake cycles. Adrenal glands, located on top of each kidney, these glands produce cortisol, aldosterone, and epinephrine. Pancreas, an organ with both endocrine and exocrine functions, it releases insulin and glucagon to regulate blood sugar levels. Ovaries in females and testicles in males, responsible for producing sex hormones, estrogen, progesterone, and testosterone. Relevance in nursing. Understanding the structures helps in assessing and diagnosing endocrine disorders. Function of the endocrine system. Regulation of hormones. The endocrine system regulates hormones which act as messengers controlling various bodily functions. Hormones' role in body functions. Hormones influence metabolism, growth, stress responses, and more. Interactions between endocrine organs. These glands work together to maintain homeostasis, impacting multiple body systems. Negative feedback loop. Explanation of negative feedback in hormone regulation. Negative feedback is a control mechanism where the body reacts to an excessive stimulus by counteracting it, maintaining equilibrium. Role in maintaining homeostasis. Negative feedback loops are crucial for keeping hormone levels in balance and preserving the body's stability. Relevance in nursing. Monitoring and interpreting hormone levels are essential for diagnosing and managing endocrine disorders. Thyroid gland. Anatomy of the thyroid. The thyroid consists of 2 lobes connected by an isthmus located in the front of the neck. Function and hormones. T3 and T4. Thyroid hormones. T3 and T4 regulate metabolism, energy production, and body temperature. Regulation through negative feedback. T3 and T4 levels are controlled by a negative feedback loop involving the hypothalamus, pituitary, and thyroid gland. Hyperthyroidism and hypothyroidism. Imbalances in this feedback system can lead to hyperthyroidism and hypothyroidism, each with distinct clinical manifestations. Clinical manifestations and nursing care. Nurses play a pivotal role in caring for patients with thyroid disorders, helping manage symptoms and treatment. Pituitary gland. Anatomy of the pituitary. The pituitary gland comprises the anterior and posterior lobes and is nestled at the base of the brain. Hormones, GH, ADH, TSH, growth hormone, GH, antidiuretic hormone, ADH, and thyroid-stimulating hormone, TSH, are produced and regulated by the pituitary. Regulation through negative feedback. These hormones are tightly regulated by negative feedback loops involving the hypothalamus, target glands, and peripheral tissues. Hyperpituitarism and hypopituitarism, abnormalities in pituitary function, can disrupt these feedback loops, leading to hyperpituitarism or hypopituitarism with specific clinical implications. Acromegaly, gigantism, pituitary adenomas. These are conditions related to excess growth hormone production and pituitary tumors, posing unique nursing challenges. Nursing implications. Nurses need to monitor hormone levels and educate patients about pituitary-related disorders and the importance of feedback mechanisms. Parathyroid and pineal glands. Anatomy and function. Parathyroid glands regulate calcium levels in the blood, and the pineal gland influences circadian rhythms via melatonin secretion. Role of parathyroid hormone, PTH. PTH is vital for maintaining calcium and phosphorus balance, and its secretion is regulated through feedback mechanisms. Melatonin and circadian rhythms. Melatonin secretion is influenced by the feedback loop involving the suprachiasmatic nucleus in the hypothalamus. Nursing considerations. Nurses should be aware of the implications of parathyroid and pineal gland disorders and their impact on calcium and sleep regulation. Adrenal glands, anatomy and hormones, cortisol, aldosterone, epinephrine. The adrenal glands produce cortisol, a stress hormone, aldosterone, regulating electrolyte balance, and epinephrine, a stress response hormone. Cortisol synthesis and secretion. Cortisol production is tightly regulated by the hypothalamic pituitary adrenal (HPA) axis and its feedback mechanisms. Regulation through negative feedback. The HPA axis employs negative feedback to maintain cortisol levels within a narrow range. Adrenal cortical insufficiency, Addison's disease. Nursing management involves monitoring cortisol levels, recognizing the signs of adrenal insufficiency, and responding accordingly. Nursing management. Nurses play a pivotal role in monitoring adrenal function, recognizing deviations from homeostasis and supporting patients with adrenal disorders. Pancreas. Anatomy and hormones. Insulin and glucagon. The pancreas is both an endocrine and exocrine organ. Producing insulin lowers blood sugar, and glucagon raises blood sugar. Regulation through negative feedback. Insulin and glucagon levels are tightly controlled through feedback mechanisms involving glucose sensing. Diabetes, types 1, 2, and gestational. Understanding the differences in diabetes types and their management is essential for nursing care, including insulin administration and dietary adjustments. Diabetes. Types of diabetes. Diabetes type 1 often presents in childhood or adolescence and is characterized by an autoimmune destruction of pancreatic beta cells. Patients with type 1 diabetes are insulin dependent. Diabetes type 2 typically presents in adulthood and is associated with insulin resistance. Many patients with type 2 diabetes may not initially require insulin. Gestational diabetes develops during pregnancy and often resolves after childbirth. Ovaries and testicles. Anatomy and hormones. Estrogen, progesterone, testosterone. Ovaries produce estrogen and progesterone, while testicles produce testosterone. Regulation through feedback. Estrogen, progesterone, and testosterone levels are regulated by feedback loops involving the hypothalamus and the gonads. Hormonal imbalances and relevant nursing interventions. Nurses should be prepared to address the clinical manifestations of hormonal imbalances and support patients through feedback-driven treatments. Hypothalamic pituitary thyroid feedback. Regulation of thyroid hormones. The hypothalamus and pituitary gland work together to regulate thyroid hormone production through feedback loops. Nursing role in monitoring thyroid function. Nurses must understand the feedback mechanism to assess thyroid disorders accurately and provide appropriate care. Diabetes insipidus. Explanation of diabetes. Insipidus. Diabetes insipidus is a condition characterized by excessive thirst and urination, often due to a deficiency of ADH. Clinical manifestations and nursing care. Nurses play a vital role in managing fluid balance, recognizing ADH deficiencies, and supporting patients with diabetes insipidus through hormone replacement therapy. Hormones in detail. Antidiuretic hormone, ADH. ADH regulates water reabsorption by the kidneys, influencing fluid balance. Understanding its feedback regulation is essential in nursing practice. Thyroid-stimulating hormone, TSH. TSH controls thyroid hormone production and secretion following feedback mechanisms. Thyroid-releasing hormone, TRH. TRH regulates TSH release from the pituitary through feedback loops. T3 and T4. These thyroid hormones influence metabolism and energy production, with their production and release tightly regulated by feedback loops. Growth hormone mechanism of action. Understanding how GH influences growth and metabolism is crucial for nursing care, considering feedback mechanisms that regulate its secretion. Regulation of cortisol synthesis and secretion. Diurnal secretion of cortisol. Cortisol secretion follows a daily pattern, impacting stress response and body functions under the control of feedback mechanisms. Adrenal cortical insufficiency, Addison's disease. Nursing management involves monitoring cortisol levels and recognizing the signs of adrenal insufficiency. Patients with Addison's disease may present with physical characteristics such as weight loss, fatigue, hyperpigmentation, and low blood pressure. Nursing implications. Nurses must be vigilant in recognizing and managing adrenal disorders and cortisol-related issues, considering the feedback loops involved. And there you have it, a comprehensive journey through the intricacies of the endocrine system and its profound impact on nursing care. I hope you found this educational exploration as enlightening as I have. Remember, nursing isn't just a profession, it's a calling. Your dedication to understanding these complex systems, your commitment to patient care, and your passion for making a difference in people's lives. That's what truly defines you as a nurse. As we conclude this video, I want to remind you that your journey as a nurse is ongoing. The pursuit of knowledge, the commitment to excellence, and the empathy you bring to your practice are the hallmarks of your incredible profession. Thank you for joining me here on Wally's Nursing Videos. Your support, questions, and engagement inspire me to continue creating content that empowers nurses and healthcare professionals worldwide. If you have more questions, topics you'd like to explore, or if you simply want to connect, don't hesitate to leave your thoughts in the comments. Your feedback is invaluable. Until next time, keep up the fantastic work, keep learning, and keep caring. As a nurse, you have the power to change lives, and for that, I salute you. Take care, and I'll see you in the next video. Goodbye for now.